Nonetheless, if patients can tolerate treatment, that means in spite of the fall in platelets, white blood cells, red blood cells, if it is successful, the benefit is great and disease progression is reduced. Cirrhosis from autoimmune hepatitis, other causes, autoimmune, autoantibodies, and non-alcoholic fatty liver disease, biliary cirrhosis, cardiac cirrhosis, hemochromatosis, Wilson's disease, iron deposition, copper, excess copper, anti-trypsin deficiency, and cystic fibrosis. Autoimmune hepatitis is a chronic disease of unknown cause, but because it's simple, you are producing antibodies against the liver. So hindi na siya unknown. Okay? Characterized by continuing hepatocellular inflammation and necrosis and tending to progress to cirrhosis. The proposed pathogenesis of autoimmune hepatitis involves the combination of genetic predisposition and environmental triggers. The spectrum of non-alcoholic fatty liver disease includes simple hepatic steatosis to NAS with the subsequent development of fibrosis and cirrhosis. Okay? Here, you have a normal liver, then you get here a fatty liver, and ultimately fibrous liver, and ultimately cirrhosis. Okay? Biliary cirrhosis, you see the color is green. Green liver. Somebody asked me, do you have green honey? But this one is green liver. Biliary cirrhosis has pathologic features that are different from either alcoholic cirrhosis or post-hepatic cirrhosis. Yet, the manifestations of end-stage liver disease are the same. The problem is with the bile flow. Either the block is in the liver or outside the liver. Cholestatic liver disease may result from necro-inflammatory lesions, congenital, acquired or metabolic, or external bile duct compression or outside. If it is outside, that can be corrected surgically. The major causes of chronic cholestatic syndromes are primary biliary cirrhosis, okay, autoimmune cholangitis, primary sclerosing, and idiopathic adult ductopenia. That means the bile system is lacking, okay, inadequate. Biliary cirrhosis, etiology, extrahepatic bile duct, okay, obstruction, biliary atresia, gallstones, strictures, carcinoma of the pancreatic head, okay, along outside the liver, okay, when there is obstruction caused by stone, cancer, stricture, anything, okay, sex predilection, none, symptoms and signs, pruritus, nangangate, okay, jaundice, yellowing, green, Malay, dark urine, okay. Why is dark urine? You go out the bile, go to the urine and you will see it's dark already. It's Coca-Cola color. Oh, that's easy. It's color like Coca-Cola. If you don't like Coca-Cola, you're not drinking that Pepsi color. Color, okay. Light stools, hepatosplenomegaly, laboratory findings, conjugated hyperbilirubinemia. Bilirubin, as it, of course, bilirubin 1, as it comes from heme, from hemoglobin, is conjugated so that it becomes water soluble to form conjugated bilirubin or 2. Okay. An increase in conjugated bilirubinemia increased serum of the alkaline phosphatase, bile acids, and cholesterol. Important pathologic findings before cirrhosis developed: prominent bile stasis in bile ducts, bile tubular proliferation with surrounding neutrophil, and portal tract edema. In primary biliary cirrhosis, not secondary, no obstruction, passively autoimmune, it destroys the bile tract in the liver, same as secondary biliary cirrhosis. Okay. Same a secondary biliary cirrhosis, plus detected serum IgM hypergammaglobulinemia. Important pathologic findings, almost pericapsular portal tract fibrosis, okay, and extrahepatic and intrahepatic bile duct problem. Develop chronic liver injury and cardiac cirrhosis because of the back pressure, right? Long-term, right? That is what we call cardiac cirrhosis. The problem is in the heart, but the result is liver problem. Long-term, right-sided heart failure. In long-term, there is an elevated venous pressure in the superior and inferior vena cava, transmitted by the inferior vena cava and hepatic veins to the sinusoids of the liver, from the vein to the sinusoid, which become dilated and engorge with blood. So the result is fatty, inflammation, the liver enlargement, which ultimately ends in cirrhosis. The liver becomes enlarged and swollen, and with long-term passive congestion and relative ischemia due to poor circulation, centrilobular hepatocytes can become necrotic. They die, leading to pericentral fibrosis. Hemochromatosis, that is congenital iron infiltration of the liver. You consider in the staining, the blue one represents iron deposits in the liver, and that can interfere with liver function and destroy the liver. Inherited disorder of iron metabolism that results in progressive increase in hepatic iron deposition, which over time can lead to a total-based fibrosis, progressing to cirrhosis, liver failure, and the end state is always cancer. Okay? Remember, why cancer? Because the job of the liver is to detoxify the body. If the liver is out of order, you are prone to develop cancer. So always improve the liver. The moment they find that you have already a fatty liver, you are already a candidate for cancer. So you have to check that immediately. The very first thing you should do is get rid of your diet. Okay? Treatment is straightforward with regular therapeutic phlebotomy, exchange, remove the blood, remove the iron. Okay. These are eosine hematoxylin stains showing the two conditions, iron deposition, Wilson's, and Wilson's disease, upper deposition disease. And you consider the structures of the liver with the nodular appearances. Here you could see in the stain, Prussian stain, the iron stain, the position affecting the liver. On the other side, the copper stain affecting the liver cells. Wilson's disease, inherited disorder of copper homeostasis with failure to excrete excess amount of copper, leading to accumulation in the liver, and treatment consists of copper chelating medication. There you have to ask Dr. Austria and Dr. King Arthur the Great to remove the copper in your blood. Chelation, okay? That's the only best for that. Okay. Now another problem is alpha-1 antitrypsin deficiency. Okay, this one, alpha-1 antitrypsin protects the lungs. If that is deficient, you can get lung problem. You can develop emphysema, and you can develop liver failure. So, and this reddening there, over there, shows to us there is an alpha-1 antitrypsin deficiency. That is a eosinophilic area, okay? Being stained. Alpha-1 antitrypsin deficiency results from an inherited disorder that causes abnormal folding of the alpha-T protein, antitrypsin protein, resulting in failure of secretion of that protein from the liver. Okay, so the liver cannot secrete that. Patients with alpha-trypsin deficiency are at greatest risk for developing chronic liver disease. Accumulation of that in the liver, that will cause liver damage. But only about 10 to 20% of such individuals will develop chronic liver disease. Uncommon cystic fibrosis. Uncommon inherited disorder affecting Caucasians or Northern European descent. We are not involved. Hindi naman tayo to check. A biliary type of cirrhosis can occur, and some patients derive benefits from the chronic use of oodles, complications of cirrhosis, portal hypertension, gastroesophageal varices, portal hypertensive gastropathy, splenomegaly, hyperesthenism, ascites, spontaneous bacterial peritonitis, hepatorenal syndrome, hepatic encephalopathy, everything has been discussed, hepatopulmonary syndrome, you get emphysema, portopulmonary hypertension, malnutrition, coagulopathy, falling thromboplastin, and all factors, factor deficiency, all 13 factors, fibrinolysis, thrombocytopenia, low platelets, the result is bleeding, bone disease, osteopenia, osteoporosis, osteomalacia, softening of the bone. Okay. Hematologic abnormalities, anemia, hemolysis, thrombocytopenia, neutropenia. Okay. Can I continue? Do you still allow me to continue? Yes. Pasensya na po. Nakakaba kasi nito. Kasi I really have talked on something I want it so extensive as if you are just student. Postgraduate course talaga. Kaya ginawa ko. Avoid offending causes like alcohol and or medication. Address other disease components that lead to this condition like metabolic syndrome, hepatitis, Wilson's disease. Correct nutritional deficiency. Reduce inflammation and fibrosis through diet modification and proper supplementation. Administer the RCB, Rapid Cellular Balancing. That's how I manage liver cirrhosis. What is RCB? It is a combination of biochemical salts, vitamins, co-enzymes, enzyme cofactors, chain breaking, and membrane stabilizing antioxidants. Essential amino acids is given to improve the body's electrolyte balance and enzyme synthesis. For example, production of superoxide dismutase, that is a powerful antioxidant produced in the body. In destroying, and glutathione peroxidase also produced in the body from glutathione in destroying free radicals and detoxification of toxins by the liver cells. To enhance release of stem cells from bone marrow and make this available to the damaged, diseased, or dysfunctional tissues of the body. Remember, stem cells from the bone marrow, the hematopoietic stem cells can become red blood cell, white blood cell, and platelets. Okay, so you can correct the cellular deficiencies there. Correct nutritional deficiency through diet modification and proper supplementation. Diet should be high protein, high fat, and low carb. I repeat, pyramid diet is not pyramid diet, okay? The diet must consist of the following: eggs, plenty of eggs, a source of choline, cysteine amino acid, raw milk, whey and dairy products, ruminants meat, calf, liver, and bulalo, fruits and vegetables, papaya, fish with fins and scales. Correct nutritional deficiency through diet modification. High fat, consumption of entry fatty acids found in fish like salmon or in Tagalog salmon, and walnuts, remember, improve blood lipid profiles and reduce inflammation, steatosis, fatty liver, and liver damage in non-alcoholic fatty liver disease. That is in Hepatology Journal 2006. High fat must not come from PUFA, polyunsaturated fatty acid, like corn, oil, soybean oil, and canola. Remember, the liver cells commit suicide in the presence of PUFA. They cannot tolerate that. They can only tolerate saturated fats. See? Because they can induce mild steatosis, twofold increase in hepatic acid triglyceride compared to control, and huge hepatic inflammation due to what? Polyunsaturated fatty acid. They are also involved in liver oxidative stress. Okay, so PUFA is no for liver problem. Correct nutritional deficiency through diet modification. High fat. A high-fat diet with high level of medium-chain saturated fatty acid Example, 51% coconut oil or 86% butter did not induce steatosis, fatty liver, or steatohepatitis, inflammatory, fatty liver, while a diet with only 10% from PUFA develops steatosis or inflammation. That's imagine, just 10% PUFA, you get already liver inflammation. What's PUFA? Corn oil, canola, soybean, sunflower. Okay? And that is from World Journal of Gastroenterology, year 2005. A choline deficiency diet exacerbates fatty liver, but attenuates insulin resistance and glucose intolerance in mice with a high fat diet. So choline is very important. And where do you get all this choline? You get that from egg, liver, and brain. That is the British Journal, 2010. Now look at this. For diabetics, they are interested in lowering blood sugar. Okay? So they give them a choline deficient diet. That exacerbates fatty liver, but they say it attenuates insulin resistance and glucose intolerance in mice fed a high fat diet. As I said, if the liver is damaged, the insulin will rise and the diabetes is controlled. So if you damage the liver, you can control the diabetes. So, okay? That's why the diabetologist there recommend that. Choline deficiency, what is it? Dietary choline deficiency is associated with an increased incidence of spontaneous liver cancer and spontaneous liver cancer, just because of that. And increased sensitivity to carcinogenic chemicals. You see how choline protects you? It is not an antioxidant, but it normalizes the liver cells and protection from even getting cancer. Mechanisms proposed to explain the cancer-promoting effects of choline deficiency are as follows. Deficiency of choline causes liver damage, and degenerating liver cells are more sensitive to the effect of carcinogenic chemicals. So, lack of choline will damage the liver, and they become susceptible to carcinogenic chemicals. Choline deficiency results in decreased methylation of DNA. Choline is very important for normal DNA methylation, resulting in abnormal DNA repair. If you cannot methylate, transfer the methyl group to the DNA so that it can work, the result is cancer. Choline deficiency results in increased oxidative stress in the liver. When you say oxidative stress, the liver becomes destroyed by oxidant, increasing the likelihood of DNA damage. Choline deficiency may stimulate changes in the programmed cell death apoptosis of liver cells, contributing to the development of liver cancer. So, the cancer cells will not die if you are deficient in choline. Choline deficiency activates the powerful cell signaling molecule, protein kinase, which creates a cascade of effects that are still being investigated. That means low choline can inactivate protein kinase. Okay, next. Correct nutritional deficiency through diet modification. High fat. Choline, where do you get that? Egg, bulalo, brain, liver, as an essential component of acetylcholine. Remember, acetylcholine is to strengthen your muscle. Your muscle will not contract without acetylcholine. And where you get the power is from choline. Okay? Beneficial treatment in the treatment of hepatitis, that is we are finding tropical gastroenterology. Okay? Choline is essential for the detoxification function, high fat for the function of the liver, okay? And necessary for the correct metabolism of alcohol. Cholesterol, right? Correct nutritional deficiency to diet modification. High fat, choline. Okay. When deprived of dietary choline, fatty liver or muscle damage is developed, and signs of organ dysfunction set in. If your diet lacks choline, lacks egg, liver, bone marrow, that's the start of liver damage. Okay? Prevents fat deposition. That is from American Journal of Clinical Nutrition. Prevents fat deposition in the liver, encourage, choline takes away all the fat in the liver. So no more fatty liver. Remember I had a patient, 10 years with fatty liver. He's working with Shell or Caltex. Within few months, it's gone already with training. It's very much alive until now. For 10 years, he has been taking a lot of drugs. Under my care, in few months, it's normal. Prevents fat deposition in the liver, encourages liver fatty acid metabolism, and increases subsequent oxidation. So very important to live, right? You get a normal liver, that is your biological chemistry. Choline. If you like choline, you will become choline. Because choline is very good for the brain formation. Yes, you will have a sound mind with choline. If you like choline, you become choline. Conjugated linoleic acid, all found in fats, in the cream of the milk, and in beef belly. Yung mga matatabang baka, right? A stable component of milk fat, a very powerful natural anti-cancer, I discussed that yesterday, can suppress arteriosclerosis. So you're protected by CLA from aging of the arteries, has antioxidative effects, and shown to increase body protein and decrease body fat. Where is it found? Mostly in animal products, dairy products, milk, raw milk, butter, cheese, Indian ghee. What is ghee? That is clarified butter. Okay, use cheese. Okay, if you are a basketball player, you can use queso de bola. And preferably tatak pato, because I use eggs tatak pato. Or queso de bola, piña or pato. Or you can use any cheese that is in the frozen section. When you go to the mall, you go to the frozen section or to where the cheese are without preservative. If you go to the shelf, the cheese there are with preservative. Because if you eat cheese with preservative, that will tax the liver to remove the preservative, right? Sa frozen section sa chiller, what I mean the chiller. Red meat from ruminants, cows, sheep, and goats contains more CLA than non-ruminant meat. That means red meat contains, from ruminants, they have more CLA because they eat a lot of grass. Okay? Correct nutritional deficiency to diet quantification. High fat, CLA, conjugated linoleic acid, typically found in dairy products, do not have adverse effects on lipoprotein profile. So that means dairy product is excellent, especially if it is coming from unpasteurized raw milk. CLA from hydrogenated oils has been found to increase. Okay, hydrogenated. Okay, that's very trans fat. Increase inflammatory markers. Induce endothelial dysfunction. Problem? Unfavorably alter the blood lipid profile by increasing the LDL, HDL, and total cholesterol HDL ratio. Okay? So, don't use hydrogenated oils even though it's CLA coming from that. Use only the natural CLA from milk, the best. High protein diet. Correct nutritional basis by high protein diet. Whey protein is the biological value of whey is approaching egg. That is 100% of whey protein becomes muscle and organ or vein. But if the biological value is low, it will be thrown as uric acid. Whey protein appears to function as a natural food against cancer, HIV, overtraining syndrome in athletes, and a host of pathologies. Whey contains complex protein made up of many smaller protein subfractions, peptides, including beta-lactoglobulin, I discussed that yesterday, alpha-lactalbumin, immunoglobulins, glycomacropeptides, bovine serum albumin, and minor peptides such as peroxidases, lysozyme, lactoferrin. Each of the subfractions found in whey has own unique biological properties. If you like to know all these things, I think I discussed this yesterday, right? Correct, high protein. The study found that the decrease in branched-chain amino acids, okay, found in high protein diet, an increase in tyrosine and the BCAA-tyrosine ratio in serum parallel the severity of hepatic parenchymal damage. That means if your BCAA is low, you are in danger. So you need that, a lot of that. You get that from whey protein. could improve the dendritic cells function in cirrhotic patients. Maybe the dendritic cells are involved in reversing cirrhosis. Low carbohydrate diet. A higher carbohydrate intake was also associated with a greater odds of inflammation in morbidly obese patients than was a higher fat intake. Okay? If you take high carbo, that will inflame during the day. You take high fat intake, you are safe. Effects on both insulin sensitivity and lipid markers have been found in response to low GI carbohydrates, low glycemic carbohydrates, and high fiber intake from fresh fruits, vegetables. That means if you eat carbo, you should have the low glycemic. That means it will not increase your blood sugar. And there I advise unpolished rice, whole wheat bread. Okay? Lecithin supplementation. That's what we give to our patient. Phosphatidylcholine and choline, they are all protective against liver disease. The nutrient is abundant in egg yolk, red meat, liver, whole grains, cauliflower, lettuce, and legumes. Lecithin, phosphatidylcholine is used in the treatment of acute and chronic viral hepatitis. They found out lecithin works. Okay, you see, just nutrition you can control viral hepatitis. Okay, cirrhosis of the liver has improved with lecithin, phosphatidylcholine. Decreased bile solubility and diabetic fatty liver. Okay. Drug-induced liver damage can be reversed by lecithin, phosphatidylcholine. Toxic liver damage, fatty liver, okay. Alcohol-induced liver disease, and general liver support. How important is choline? Next is the carnitine. Remember carnitine? From the word carne, it comes from meat, red meat. Carnitine is very important for beta-2 oxidation of fats, so that the heart can use them. L-carnitine supplements can improve liver functions, liver histology, and other manifestations of non-alcoholic steatohepatitis. This nutrient is abundant in red meat or meat of ruminants, dairy products, and eggs. American Journal of Gastroenterology 2010. Mukhang nakikita na nila. Alpha-lipoic acid, another antioxidant in red meat, again red meat, organ, meats, heart, liver, and brewer's yeast is a vital antioxidant that boosts the power of other antioxidants like glutathione and vitamin E. Alpha-lipoic acid can recycle oxidized glutathione, which is dangerous to reduce glutathione. Okay. The effects of this nutrient include normalizing blood sugar level, improving nerve blood flow, reducing oxidative stress, alleviating diabetic neuropathy, and protecting membranes. Alpha-lipoic acid is a free radical